Hello, I want to address fertility and assisted reproductive techniques during this time of coronavirus. It's a common anxiety when women want to have a baby and might need assistance, and for a lot of couples it's a very painful and difficult time, and the coronavirus drama makes it no easier. When everyone else is making jokes about the fact that in 9 months' time we obstetricians might be really busy delivering babies, it's probably extremely painful for people to hear that, knowing that that might not be a simple option for them. And not only that, their plans to maybe move on with fertility treatment or IVF have been completely sidelined by the current recommendations by both the federal and the Victorian government to sideline IVF services for the immediate time. So I want to address first, should you have a pregnancy? Well, look, there's never a good time. There's a million reasons not to have a baby, and there's very few reasons to have a baby. But it's a biological imperative. Everybody wants to do it, and not everybody wants to do it, but it certainly has its upsides. I think that taking into account coronavirus, the best thing you can do if you're planning to be a parent is to take the information that is given to you and take the facts available and make the best decision for yourself at the time. So there is no significant or simple one answer for everybody. For some people, this is a very bad time to consider having a baby. For other people, there is never going to be a good time, so you may as well get on with it now. The first thing you need to know about coronavirus and pregnancy is it fortunately doesn't seem to affect pregnant women or newborn babies in the way that we would be very concerned about. So although pregnant women are considered to be a vulnerable group simply because they are immunocompromised, so their immune system is lowered by the fact that they're pregnant, they're not more affected by pregnancy and coronavirus than other people who are not pregnant. Nevertheless, it's not a great time, but then the influenza is not a good thing to have when you're pregnant either. So the point is that you need to take into account your own personal circumstance. The older you are, if you're above 35, the less time that you have, and so therefore you need to take into account that, and that you might not have a lot of time to play with. The second issue is cost and financial issues. For some people, if they've lost their job or neither people in a partnership are working, it might be financially a very strained time to have a baby. On the other hand, working from home or your partner being more available because they're not working at the present time might actually be a good time to have a baby and to make use of the time you have together at home. So bearing that in mind, I think that you need to take into account your personal circumstances. I think you look at the costs, you look at your age, and you look at other potential issues, and know that this whole controversy and this whole crisis time is going to be over. So I don't think it's a reason not to go ahead and have a baby. You just need to take into account your personal circumstances. It can be quite difficult to make that decision, so seek care from your healthcare provider or any psychological support that you might need to help you make that decision that is an appropriate decision for you. The second thing with reproductive services is that they have unfortunately been sidelined for the moment. Most of you who might be already in an assisted reproductive technology cycle will know that you will finish that cycle, but no new cycles are being commenced. So in late March, on the 25th of March, the federal government of Australia decided to stop all elective surgery unless they were category 1 or more urgent category 2 surgeries, and so therefore, unfortunately for the purposes of this pandemic, reproductive services surgery is not considered to be a category 1 surgery. The second issue about that is that if you are currently in a cycle, you will potentially be completing your cycle of treatment, and you should do that. You need to contemplate, if you're not currently going into a cycle of treatment, making sure that everything is all sorted out, that your ducks are lined up in a row so that you're ready to get going as soon as your reproductive technology is available again, which hopefully will be in the next few months. And sidelining reproductive technology for 2 to 3 months is not likely to have a significant effect on your reproduction. So I will be posting more information about this. I hope this has been a bit helpful, but one of the wonderful things about the human spirit is we go on regardless. So don't give up hope. Just get yourself organised and start to make good decisions that are appropriate for you. Don't worry about what everyone else is doing. Consider your circumstances and take appropriate advice.